Hello, everyone. I am Timeyin Ogungbe, a community pharmacist with over 20 years experience, and I'm also a volunteer for the Tabitha Widows Care Foundation. Today, I have a topic that is so dear to my heart. So, forgive me if I begin to sound passionate, and forgive me if I shake the table on which you are sitting. But we need to tell ourselves some truths, and I'm going to be talking about misuse of medications, drug misuse. I didn't use drug abuse, oh, it's drug misuse. Misuse is when you use a particular drug in the wrong way. Drug abuse for me means, okay, drug abuse is actually also part of it. You are abusing the drug, you are using it, you are addicted to it. In misuse, you are not necessarily addicted to it, but you are using it in the wrong way and for a wrong purpose. And we see a lot of it. So for someone who has practiced for 25 years like me, I have seen plenty. And that's what I want to be talking about today. You see, drugs are like fire. They are good servants, but they are bad masters. And when you begin to use them in the wrong way, the benefits they are supposed to be giving us will now turn to bad. Now, as pharmacists, there's a mindset with which we think when we look at a particular drug or when we look at somebody who has a particular health condition. We don't think just efficacy. Is this drug going to work? But we're also asking ourselves, is it safe for this person? And that is huge because there are so many people that land in the hospital, and if we were to trace it, it was because of drug misuse. Why add to the burden already on ground with regards to health diseases like diabetes, hypertension, malaria, and all the other, even cancer, all the other diseases that are on ground? Why add the burden of illnesses caused by drug misuse to that burden? And another mindset with which pharmacists think, we think like this: if we see a health condition, we'll be asking ourselves not what drug can be used to solve this problem, but we're asking ourselves what drug caused this problem also. So that mindset is what makes us very careful when it comes to medications. In fact, we pharmacists are the ones that are very, very careful to even take medications that others will freely recommend or give out or take. And it is because of the knowledge of the side effect, of the adverse effect of these medications that has somehow in our training impacted on our reasoning, on our mindset, that we are very cautious when it comes to medicines. Now, I will start with a number of instances or cases or drugs that I have encountered in my over 20 years of practicing pharmacy, that I always have issues with my clients because they've come to see me like a police. Sometimes they even run away from the pharmacy because I'm going to be asking them, why do they want to use this drug and what is the condition? Well, but over time, at least people have come to realize that we mean well for them. I will start with one very, very popular and widely used medications: antibiotics. See them? Antibiotics. This is not the type of, some of them come in tablets, but I just brought out these ones for us to see. Antibiotics. Now, antibiotics are a breakthrough in modern medicine because without them, someone like me who underwent surgery to bring out my baby through CS, it would have been near impossible because that's what they call that incision they gave me will have become contaminated by bacteria, and I could have lost my life. So you see, antibiotics have been very useful in treating so many health conditions also, as in so many diseases like whooping cough, tuberculosis has been made effective through the use of antibiotics. Even surgery, of course, I talked about my CS surgery. So antibiotics, don't get me wrong, they are very good as servants. But when you begin to overuse them and misuse them, so many things happen. Chief of which is antibiotic resistance, which is what we are seeing these days. We are seeing a lot of antibiotic resistant cases where you will see lab reports of a culture that was done, bacteria seen, and then you will now look at the different types of antibiotics that was tested to see which one is going to be um, effective in tackling it, and you will find R, which is resistant. R. I've seen a result like that. Everything was R, and I'm like, this is a clear case of an antibiotic resistance. Such a person had to be referred to the hospital because it was really, really bad. And we are seeing a lot of cases, and we are we are getting to a point where if we are not careful, antibiotics will not work. Yeah. And that's a threat that is even bigger than terrorism itself. That means now bacteria now has the ability to terrorize us. Antibiotics, when you and one of the causes of antibiotic resistance is indiscriminate, frequent, empirical use of it. You don't even do tests, you don't even know what you are just using an antibiotic. Overuse of antibiotic leads to antibiotic resistance. But there's another issue now that we are beginning to be aware about. Overuse of antibiotics can also lead to poor immunity, ironically, poor immunity, and a situation where your body is under a state of chronic inflammation. That's the new body of knowledge now coming out, that when you take an antibiotic, you are eradicating the friendly bacteria God has put in you. So not they're not just friendly, they're not just friendly, they are helpful. They do a lot of work. Maybe I will do another video on these friendly germs that reside within our digestive system so that you will know the huge impact of antibiotics on them. So what happens briefly? Let me just give a rundown of what really happens when we take an antibiotic. The antibiotic is not selective. It does not know which one is the friendly one and the bad one. So when you take it for anything, both the bad one, both the bad germs, the bad bacteria, and the good one, they are all gone. And when they are all gone, your defense mechanism that God has put in your digestive system, which are the friendly germs, are also gone. So you are now exposed again to another set of another risk of getting another infection. And then you just find out that the more you are using an antibiotic, the more and more you fall ill of another infection. So misuse of antibiotics can lower your immunity, ironically. There was a case like that. Let me give you a classic example of a case like this, where this person had used antibiotic. Oh, what you don't use and tire. And you know, that's another thing. We have this mindset that every single sickness is an antibiotic that will solve it. Every single thing. Especially when you say malaria, typhoid, you see those two, they don't suffer. Malaria and typhoid are suffered in our hands. So, every single sickness, malaria, typhoid, and you take drugs, you don't get better. You now think, oh, let me take higher one. You see people come and give me strong antibiotic, and I'm like, strong antibiotic, what's the issue? So you see, overuse of it, maybe because of and again, that's another thing. Let me just briefly talk about it. You see, that test called Widal test is actually an inconclusive test for typhoid. Because I'm saying this because one of the the most common use of antibiotics is in the use of typhoid. So they will use that Widal test and say, oh, okay, it is reactive, I have typhoid, and then the next thing they are drinking antibiotics again. That test is globally recognized as an inconclusive test for typhoid. If you want a better and more conclusive test for typhoid, please speak to your health practitioner, your healthcare provider. Okay, so these are some of the things that would cause us now to use an antibiotic. You are coughing small, you are taking an antibiotic, and it could be viral because the antibiotic doesn't work for only works for bacteria. It doesn't work for viral infections. And most of the time, especially during this season when there's cough and cold because of the weather, a lot of people now take antibiotics because they have cough and kata, cough and kata. Meanwhile, it could be viral, and viral diseases are self-limiting. That means if your immunity is strong, it will clear it off with time. You now say, oh, I'm coughing, I take an antibiotic. So you see, these are the most common reasons why people will use an antibiotic, and the demand for antibiotics every day is increasing. And as I said, you're affecting, you're causing antibiotic resistance, and you are also lowering your body's immunity. So this is the first drug I really wanted to address, as in the first drug I want to address, and I think I've been able to address it sufficiently. And I hope I have been able to convince you and not to confuse you that indiscriminate use of these antibiotics can lead to more harm to you. But I'm not saying that you don't need if you need antibiotics, you shouldn't use. But please work with your healthcare provider to be able to decide whether indeed what health condition you are complaining about is actually antibiotics or not. And if it is, it's better you even test before you treat so that you know the right antibiotics to use. Thank you very much. I think this video is going to be long if I continue with the rest. So we are going to pause here, and in the next video, we will continue with misuse of drugs. Thank you very much. I remain anti-pharmacist.